Hi, my name is Katie Lindgren-Rank. I mention this because we all haven't been together since March, and if I have seen any of you, it's been while wearing a mask. I admit I enjoy the anonymity. It makes me feel like I've got an air of mystery. Anyways, I'm not vamping. I chose thyroid cancer at the suggestion of Kelly Regan because I honestly have never known anyone with the disease. It really doesn't get the publicity that other forms of cancer do. If I could direct your attention to the upper corners of the header, that is the thyroid support ribbon. It's definitely not as recognizable as some of the others. It is distinctive because of the butterfly in the design. The thyroid gland is most often described as looking like a butterfly, although the ones I saw in my research looked more like the letter H or a very intense handlebar mustache. The thyroid gland is located on the anterior aspect of the neck, just above the jugular notch. First on the list of surprises about this disease is that there are 4 separate types, 3 of which are generally very slow growing. That would be the papillary carcinoma, follicular carcinoma, and medullary carcinoma. They grow so slowly, in fact, that approximately 1/3 of older adults have the disease, and it does not affect their quality of life. Thyroid cancer can develop due to a couple of risk factors. Mostly, it occurs due to mutations to a person's genes. And we were literally just learning about this in physics with Dr. Pap. Specifically, it's due to a mutation of the RET gene, making it into what's called a PTC oncogene. This process leads to the increased cell growth and division, which is the hallmark of tumor formation. This type of mutation is not inherited and is seen in people exposed to large amounts of radiation. Follicular carcinoma is often seen in people who have iodine-poor diets. Iodine is a mineral found in food, mostly for us in iodinized salt. The thyroid gland uses this mineral to manufacture thyroid hormone, which helps run the show for blood pressure, body temperature, and a number of other organs. A lack of this mineral can cause other oncogene mutations, again causing the development of thyroid tumors. Family history of thyroid cancer can point to increased occurrence as well. So, if tumor formation is undetected, it can produce some outward signs and symptoms. The most often occurring is the presence of a nodule or a thyroid tumor. It can be seen or felt in the base of the throat. Because this is happening in such a small space, thyroid cancer can lead to these other symptoms listed here, depending on where on the gland the tumor is. As mentioned before, people who have been exposed to high levels of radiation, have a poor diet, or family history are prone to developing the disease. Statistics show that a higher occurrence is in white women, 3 times more than men, but later diagnoses are seen in African American women as well. The diagnosis follows procedural, like for most cancers. The patient is referred to a specialist, in this case an endocrinologist. The nodule is imaged by an ultrasound to see if it is indeed a tumor or possibly a cyst. And that leads us to the ultrasound here, which I really enjoyed because it was annotated to show exactly what we're looking at, because I don't know how to read ultrasounds. But the nodule itself is outlined in the green perforated line within the left thyroid lobe. Next, the endocrinologist would order blood work to measure hormone levels and to see if a biopsy is necessary to determine if the tumor is malignant. If the a tumor is found to be malignant, the next surprising step is to wait. This is a slow-growing cancer, and only 10% of nodules or tumors turn out to be cancerous. So conventional wisdom is to wait and re-examine the tumor for growth or spread every 6 to 12 months. That's really nerve-wracking. All that testing to have to wait. It seems like the worst staring contest in the history of ever. So I'd like to apologize for the photo here of this excised thyroid gland and part of the larynx. I know it's graphic, but this picture ultimately led me to choosing this case for my paper. It's an invasive papillary carcinoma found in a white male, age 64, who had been experiencing bloody sputum a number of times. What is interesting is you can see the tumor itself right under the thyroid cartilage. It's practically pointing to the tumor like an arrow. Excuse me. So this would be part of the treatment process, either a partial or a total lobe or thyroidectomy, followed by chemotherapy using radioiodine, and also radiation therapy would more than likely be entered into the treatment plan as well. The best thing about this particular cancer is its survival rate. I actually read that it is the best endocrine cancer to have if you have to have one, which is great. Granted, it's still cancer and we have to protect ourselves, which is why we wear the thyroid collars whenever we go into fluoro exams. But it's good to know that if we do contract this disease, that there is a good amount of hope for a cure or a good quality of life. Thank you for your interest. Thank you, Kelly, for suggesting this, and thank you, Deborah Smith, for all of your research. Thanks, guys. Stay well.